So, hello everybody. Today we talk yet another very interesting and very important topic which we use every day in our ICU practice, in and out, for resuscitation, for maintenance, for various administration of drugs. We actually abuse them. So, today we'll discuss how do we actually rationalize our use of IV fluids, where all IV fluids are indicated, what is the evidence based behind usage of IV fluids, behind usage of different kinds of IV fluids, and which is superior, which is inferior. Okay. So, why are we talking so much about IV fluids? Definitely you know that 60% of our body weight is comprised of fluids. Out of this 60%, your 2/3 of the weight is water is present inside your intracellular, that is inside your cells. And the rest 1/3 is the actual important one which we deal with it. So, 1/3 of the fluid is present in your extracellular space. Out of this 1/3, again the 80% of the fluid is present in your interstitial space, in between this space. So, 80% is in the interstitial space. So, the least important, that is the 20% of the fluid which is part of the 1/3 of your extracellular fluid, holds the major hemodynamic or homeostatic balance of the entire body, that is your plasma. So, it is this 20% of the plasma which alters your entire hemodynamics and contributes to all your fluid and electrolyte physiology. So, the 20% is the plasma, as well as this extracellular fluid also comprises some amount of the lymph, CSF, synovial fluid, the pericardial fluid, the pleural fluid, the vitreous humor present in the eye, the aqueous humor present, the perilymph fluid, the endolymph fluid, every small amount of fluid present. So, in percentage of body weight, how do we guard our total body water? So, when it comes to a premature infant, it is about the 80% of the body weight. So, the entire body water in a premature infant will be 80%. In a term infant, it will be around 70 to 75%. In a toddler, it is going to be around 65 to 70%. Adult male, we come down to 60%, and a female, it is around 50%. Whereas, as you age, you come to 50% in an elderly male and 45% in your elderly female. This is the percentage of water as per your total body weight. So, the composition of your fluids, the intracellular fluid as well as extracellular fluid. Your extracellular fluid is predominant by cations like sodium and to small extent by anions like chloride and bicarbonate. Very important to remember, sodium is a extracellular cation. Sodium is mostly present in the extracellular fluid, whereas in your intracellular fluid you have mostly potassium. So, in your extracellular fluid, it is the sodium which is your majority of the cation, whereas in your intracellular fluid, your potassium is your major cation. Other than this, your cations, you have anions in your extracellular fluid, which is chloride and bicarbonate, and other anions like protein, small amount of albumin and other proteins and glycogen present in your intracellular fluid. So, how is this being maintained? The extracellular fluid cations remain in the extracellular fluid, whereas the intracellular fluid cations remain inside the intracellular fluid. This is maintained by a Gibbs-Jonans equilibrium, which shows that the electroneutrality across these membranes is always being maintained either by your pumps, that is you have your sodium potassium pump, or you have your sodium water pump, or you have your sodium potassium and your H plus pump. So, this Gibbs-Jonan equilibrium states that the electroneutrality across your intracellular fluid and extracellular fluid is being maintained by these pumps. In addition to this, we always knew that there is some amount of oncotic pressure which is guarding these extracellular, intracellular fluid from entering into